Tēnā koutou katoa, he mihi nui, he mihi mahana. Kia koutou katoa. Ko Davina Jones toku ingoa. I whānau mai aho I Leicester I Ingarangi. Kei Karorio e noho ana. Kei Oranga Tamariki o e mahi ana. Kia ora hui hui matato. Welcome everybody. I'd like to welcome my co-presenter today, Paul Arts, who's the business owner for Family Start within Oranga Tamariki. I'd like to welcome our partners from Allen and Clark, who have recently won the contract for our current evaluation of Family Start, and will be working closely in partnership with the Evidence Centre on the current evaluation. And they've put together a multidisciplinary team for this work. I'd also like to welcome the Family Start providers themselves who've made it to our presentation today. Thank you for being here. So, capitalising on big data. As Anna said, we're really lucky in New Zealand that we've got a data set as rich as the IDI. It is the envy of many other countries. And at the same time, I'd like to make a call for first principles, that we start with what are the key questions that we want to answer, the key research questions, the key evaluation questions, rather than jumping too quickly to the method or the data set. So yes, we're very excited about capitalising on the IDI and the possibilities that it allows that were not there a few years ago. And at the same time, we've got other questions that we want to know. We want to know not only is Family Start effective, but how is it effective? And why is it effective, or not, as the case may be. So, quick rundown of what we're going to talk about today. We're going to talk about, Paul, first of all, will give us a rundown on the history of Family Start and what the programme actually is. We'll then reflect together on the evaluation history of the programme and what we already know so far, which brings us to the current juncture and the evaluation rationale now. Evaluation rationale for now, which is understanding about what works and are we making a difference with this programme for Tamariki and Whānau, and actually adding in to those insights rich understandings from the ground. So over to you, Paul.
I'm just going to give a bit of an overview and an insight to what the Family Start programme is. Well, I'll approach this from three angles. Firstly, who are the families that are accessing the Family Start program? Bit of an overview on that. What the service is, so how the families experience the Family Start program, and thirdly, I've got a little video clip that I wanted to share with you. So, who accesses the Family Start program? Well, it is a targeted program. So, families that are expecting a baby or have an infant under 12 months of age can come onto the program, and then they can stay on the program until the child turns 5. The families that come on, the program is designed to support and assist families who are facing significant barriers to being able to provide that nurturing and caring environment for their family. So the sorts of issues obstacles that families are facing are things like mental health difficulties, family violence, addiction problems, sort of housing insecurity. So these are the things that families are facing that are impacting on their ability to care for their baby or infant. So then what does the service look like for the families? Well, families will receive intensive in-house home visiting support, weekly home visits, fortnightly home visits. So a fairly intensive service. Together the Family Start worker and the family will put the baby right at the centre, baby, the infant, the toddler, and look at everything that's impacting on the welfare and well-being of that infant. So essentially, anything that's in the environment that's inhibiting healthy child development is potentially in scope for the Family Start program. Central to that is what the family are doing, what the parents, the caregivers are doing. So how are they interacting, how are they providing, how are they creating that nurturing environment that all of the evidence and science shows a baby needs to really develop optimally. So core to the program is specialist information and advice on parenting and child development. So what I'll do now is I have a short video. So this one is part of a kete of resources that are available to support the front line. And I think it's quite nice because it'll give you a bit of an idea and a bit of a feeling for the program and what it is. And you'll see spread through it as well the sorts of resources and tools and prompts that the frontline staff use.
Before I try to develop an effective plan with whānau, I work on building trust and establishing a positive relationship with them. Setting goals is much easier then. I talk about what I've seen during my time with the whānau, particularly describing the child's behaviour. This keeps things real. Any plan should relate to the strengths and needs assessment of the whānau. The plan should look at practical ways to meet any outstanding needs or risks for pepe. While some of the goals in the plan might need to be focused on issues like stopping family violence, getting help with addiction problems or finding a house, I always make sure to include a goal purely focused on parenting. I talk with parents about things they can do with baby every day that is fun and free, such as talking, singing or reading. I check out Whānau Says and Ngā Tohu Whānau sections in the whakatupa booklets. They're full of ideas about how parents can help. Let's have a look at the age-appropriate child development tiles in the parenting resource. These are designed to help us understand what's going on for baby and how parents and whānau can help. I love using the Aramatua parenting pathways too. They can help us to set goals that have pepe at the centre. I encourage whānau to choose things that they are interested in and include these in the plan. If I am struggling with whānau who are reluctant to work on a plan, I talk to them about their dreams or moemoeā for their children. The Thinking About Parenting booklet from Skip can be a good way to start this kōrero. I encourage them to share their thoughts about what kind of people they hope their children will be at 5, 10 or 30 years old. I ask how would they like their child to describe their childhood when they grow up. Most parents are motivated by wanting a better life for their children. Reviewing the plan at every visit is a good idea. It gives me a chance to check how things are going and celebrate the whānau successes, even if they're small. Most important, it's to keep in mind Ngā Tohu Whānau, 6 things kids need to grow up into happy and capable adults. If our plan addresses these things, then we're on the right track.
So as you can see from the slide, Family Start was developed in 1998. Previously there had been Early Start in the Christchurch area, which started in 1995, and Family Start followed after that with 3 pilot sites, and in the next couple of years it ramped up to a further 13 sites. In the mid-2000s it was expanded to a further 14 territorial local authorities. In 2011 to 12 the programme was refocused more towards the high needs end of the spectrum, with families facing more complex challenges being targeted for the programme. Over that course of time, there were a number of reviews and evaluations that were carried out as well. So by 2015, there had been a number of studies, and those previous evaluations were very useful in terms of honing the programme, how it operated on the ground, improving it, and we certainly knew that it was lined up with the international literature on best practice for home visiting programmes. But what we didn't know was whether it was effective or not. So the previous evaluations were not able to establish the effectiveness. So the Ministry of Social Development at that point commissioned a quasi-experimental impact study, and this was a collaboration between the Ministry of Social Development, AUT, the University of Auckland and George Washington University in the States to carry out that piece of work to fill that gap. The study used newly available, de-identified linked data, and ethics approval was sought for the study, both for the linking of that data and for the Family Start study itself. The key method was individual propensity score matching that Anna mentioned previously, so basically comparing outcomes for children who received Family Start, born 2009 to 11, with a comparison group of children who didn't receive Family Start, who had similar characteristics. Also, there was an area level study that was conducted alongside this that looked at outcomes for all high needs children in the areas that newly got Family Start in the mid-2000s. And one of the things that facilitated this greater choice of methodologies in the 2016 study was that since 2008, the FSNet data capture system was implemented. So with the individual level study, we had 3,291 children in those territorial local authorities where Family Start was available, who enrolled in Family Start, and they were compared to matched controls in areas where Family Start was not available. The matched controls had the same ethnicity, benefit status, birth year, and a number of other characteristics, which meant that the impact of Family Start was assessed as the difference in outcome between the two groups. The most striking finding was around mortality, that there were decreases in mortality. There was evidence, especially in the sudden unexplained deaths. These decreases in mortality were found for the results overall, and also for both Maori and Pacific children. The impact size was largest for Maori children. The mortality decreases were found for Maori children both with by Maori for Maori providers and also with mainstream providers. And a number of tests were carried out by the researchers to try and check that those results were not reflecting other efforts going on in those communities at the same time. The researchers took these results to indicate improvements in the children's home environment and level of care. And we hypothesised that the mechanisms could include the input of those Family Start workers who were encouraging families and delivering education around protective factors such as safe sleeping practices, reduced tobacco in the household, and breastfeeding. There were also positive results in the health and education domains, which suggested increased service engagement due to Family Start. So there was an increase in those who were fully immunised at age 1 and up to age 2. There was increased ECE attendance at age 4, and there was increased maternal use of mental health services in the first year post-birth, that mothers were getting the help that they needed. However, we did find a concerning decrease in PHO enrolment at age 1, but interestingly, there was no difference by age 2. So again, this starts to raise questions for us. We wondered what might be going on. We wondered whether, in some instances, the Family Start providers and the allied services that were being linked to were taken by families to be providing that medical advice rather than them actually going to the doctor. An interesting finding was that immunisation and PHO enrolment for Maori children was found with by Maori for Maori providers, but not with mainstream providers. And that's something we'd certainly like to learn more about. And again, it raises questions, so we were asking ourselves, does this reflect improved coordination of the services, where the same organisation maybe has the Family Start contract and also has some well child or Tamariki or Ora services going on alongside? We found that there was increased contact with child, youth and family, as it was then, prior to Oranga Tamariki. And that increased contact was for children, the Family Start children, compared to the matched controls, Well, we knew that one of the referral pathways into the programme was CYF referral, so there could be some circularity in the findings there, but the researchers conducted some sensitivity testing and removed those children from the analysis who had had previous contact with child, youth and family, and the results still held. So again, this raises more questions for us really. The findings highlight the difficulty of using administrative data to try to measure whether maltreatment of children is reduced, which is obviously a key question for us here in Oranga Tamariki. And questions we had around that was whether Family Start just brought forward contact with CYF that would eventually occur in any case, whether increased early contact with child, youth and family was in fact preventative, was it working to reduce harm in the longer term, and we'd need a study with a longer follow-up to follow children through to a later stage of their childhood to really be able to answer that question. And another reflection we had was, does Family Start encourage families to seek hospital care so that not seeing a reduction in injury that is really occurring as a result of Family Start is what's going on there. A safeguarding effect in terms of contact with child, youth and family is something that has been seen in international studies. For example, the Nurse Family Partnership in the United States, where there are eyes in the house, where families are being, there's an eye out being kept for families along with those home visits and the relationship that's being formed. So again, these require further research to fully unpack and understand what's going on in the mechanisms. I'd now like to hand over to Paul for him to explain what sort of utility has this sort of study had for a service design and operational team.
An interesting academic exercise without a doubt, fascinating results. But what I just wanted to point to as the business owner is kind of real life and tangible impact that this linked data analysis is having on the Family Start program. And we've many examples. I've chosen just sort of one or two in each of these areas. Firstly, I just wanted to make the point as well, you know, if you're the business owner for a program, you know the program intimately, you commission a piece of evaluation, you might kind of hazard a guess at what the conclusions of the evaluation are going to tell you, right? Well, except when that evaluation includes some linked data analysis. I can tell you from experience, you should be prepared to be surprised. And that was certainly the jump out lesson from our linked data work so far that Davina's spoken to. Importantly, it informs investment decisions. So firstly, just those findings of positive impacts from the quasi-experimental evaluation gave the government confidence to invest more in the program. It also informs other investment decisions, and I've talked about the earlier Treasury linked data work that identified risk factors for poor outcomes. Well, earlier on, when that was first released, we used that linked data exercise to make decisions about where we would invest. So that gave us information about where the vulnerable children were, so how much to invest in Hamilton vis-a-vis Invercargill. Those sorts of investment decisions, linked data has been crucial to making those. Also, within those bigger investment decisions are things like, you just heard from Davina that we found that the treated group had increased rates of ECE participation. And on the back of that finding, we were comfortable to increase our investment in a particular part of Family Start, which is this subsidy to families to meet the cost of ECE. So on the back of that finding, we actually increased and rolled out that subsidy that was still in pilot phase nationally. So those are the sorts of tangible investment decisions that the analysis has informed. Service design, so a number of service design questions, just one here. Internationally, there's, in other jurisdictions, there's examples of similar programs that are targeted particularly for first-time parents. And the question was, should we or shouldn't we be targeting first-time parents only? And subgroup analysis found that the positive findings held true for subsequent parents as well as first-time parents. So, that's a fundamental service design question that was answered for us. It guides strategic relationships. You heard Davina talking about the reductions in suri rates at a statistically significant level. That's really guided us being much more purposeful in our engagement with the National Suri and Safe Sleeping strategies. The front line, got some Family Start providers here today, and for years, the people working this, we know we're making a difference. We can see the difference we're making, hand on heart. But it's been really motivating and validating for our service providers to actually have that black and white impact evidence. Core business intelligence. One of the questions we had as a business was, are we reaching the right clients? Who are the families that we're serving? Anecdotally, we know. The linked data analysis provided us this picture of the Family Start families. I won't go through it because you can all read it. But that's this is core business information. Who is your client group? Who are you reaching? And it was through the power of linked data that was able to provide us this sort of information.
So what do we still need to know about Family Start? Obviously, we still want to know, is it making a difference in its current form? We want to look at outcomes over a longer period of childhood, particularly around that finding of increased contact with child protection agencies, CYF as it was, OT now. We want to understand over a longer period of time over a longer period of childhood, what do those outcomes look like as a result of receiving this programme? We also want to test the effects of expansion and whether the positive findings in a new study would still hold for the newly served areas. We want to unpack that impact, if it occurs, to understand how and why it occurs. What do parents and caregivers think about the effectiveness of Family Start? How do they experience the programme? How can providers be supported to maximise their chance of making a difference? And we'd like to develop more in-depth and holistic understanding about how the programme works, particularly for whānau Māori. So you might be asking, okay, the 2016 study, that was only a couple of years ago. What do we need another evaluation for now? But I think it's really important to remember that the children in the previous study were born before 2012. Since then, a number of things have changed. As I've pointed out previously, there's now tighter targeting towards the more vulnerable end of the spectrum, with families with a greater number of challenges. There's now a new education resource that has replaced the previous curriculum. It's an online parenting resource. In the early video, you saw an example of how it was used in the home with the family. And now we have national coverage. So all these are new dimensions. And with it being a large spend, we need to keep making sure that it's working. So the current evaluation has three key purposes. One is accountability, $47 million per year. We want to be confident that it's a good spend that's making a difference. There's learning goals as well. We want to learn what's working for families. We want to learn from different cultural perspectives what works and how that works. We want to value those worldviews and make sure that those knowledge bases are brought into this evaluation. And we want to be able, internally with our operational teams, to make sure that there's that continuous improvement to the programme. And holistically, all these branches together add up to the evaluation really having a key utility, not only for the service design and operational people, but to support our leadership team in making decisions about where to invest and how to invest. The previous Child, Youth and Family had quite a much narrower remit on the statutory end of the spectrum than the current Oranga Tamariki, where we have responsibilities not only for those in statutory care, but those experiencing multiple and complex needs who do not require care at the statutory level, who maybe need intensive interventions or early interventions. And the outputs of the evaluation can help input not only to those decisions, but to the development and the honing of home visiting services and practice within New Zealand. So we're using mixed methods to develop a rich picture on this evaluation, a quantitative stream with a quasi-experimental design using the IDI. We're at the early stages of setting up our partnership with Allen and Clark and with the multidisciplinary team. So we're just developing the plan now. We've got a qualitative stream with case studies, journals, and looking at implementation on the ground. We're incorporating a Te Ao Māori worldview into this project and a Pacifica worldview. And just going back to the Te Ao Māori worldview, forthcoming shortly in the ANZIA journal Evaluation Matters is a paper on the Heiaua Whiria approach, the braided rivers approach, which is a retrospective look at the 2016 study to incorporate a Te Ao Māori worldview and have a look how that study can be interpreted and understood using that frame. On this evaluation, our ambition is to embed that approach into the evaluation from the outset across all streams and to make it part of the fabric of the evaluation in both the qualitative and quantitative streams. And where we hope to get to is holistic, synthesised conclusions where the evidence streams bounce off each other. There's co-construction of meaning and insights. We braid the streams from the different knowledge bases and we create the space for dialogue and new understandings to arise. And on that note, I'm just going to finish up with the voices of some of our families who have received the programme.
I didn't know the right from the wrong, the discipline, how to teach your children, the lot. Because I've never had that in my life. I never knew there was a better way to do it, a better way to approach it.
Now I'm definitely more confident with my baby and working with my whānau worker Nicole weekly. I'm able to enjoy life. I have made some new friends and increased my social network. And when Nicole comes out to visit me, we read books and play games with Nirvana.
I learned about the well-being of my daughter, about the effect of domestic violence on the family, about my daughter's growth and development, the effects on the growing brain.
Before starting Family Start, I thought that the kids just grow on their own and stay at home. But I realised that kids need to go outside of the house and socialise with other children.